Hi, I'm Dr. Vaughn Starnes. I'm the Hastings Professor and Chairman of the Department of Cardiothoracic Surgery at USC School of Medicine. I'd also like to introduce Dr. Mark Cunningham, an Assistant Professor of Cardiac Surgery at USC School of Medicine, who's also a co-investigator in the robotic surgery program. You've been referred to me for mitral valve surgery, or you're considering having mitral valve surgery. And as a patient, you're very concerned about how we're going to do it. Am I going to have a large incision through my breastbone? Or is there some other way we can do this that I get the same type of repair, the same quality of repair, and yet I don't have to be opened up completely? The answer to that is yes. We can repair your valve. We can repair it through a small incision. We can give you the same types and the same quality of repair as though we had done the bigger incision. And we're going to approach your heart not through the big sternal incision, but through the side. And we're going to be able to do the same repair as though we did rip your chest open.
It takes two surgeons to perform the operations. One surgeon is at the bedside and one surgeon is at the console. And so I've been working with Dr. Starnes as the patient side, a surgeon.
I've been involved with the robotic daVinci system for over 2.5 years. During that period of time, we've cared for patients with mitral valve disease. We've operated on 40 patients with mitral valve disease, doing a complete repair. We've also investigated doing coronary surgery with the device, taken down the internal mammary artery, and we've also closed holes in the heart, ASD, with the daVinci system.
I went to Vaughn Starnes, I got an appointment with him, and I took a tape that had been made by my cardiologist of my heart, and he had viewed that before he came in to see me, and he came in and he said, well, yes, you have a severe prolapse and it should be repaired and you would be a good candidate for the robotic surgery.
As a patient, you're trying to understand how this big device here is going to be assisting me during surgery. The robotic arms themselves are connected to two small cylinders that have at the end of them a very small duct-like bill that holds the instruments that I'll be using. And when they get into place, I'll sit at the console, as you see here. These movements will be directly mimicked by the translation of my hand movement to the tip of the robotic arm. So if I flex my arm this way, the robotic tip flexes that way.
Well, to me, the advantage of the robotic surgery was that it was far less invasive. They didn't need to crack my sternum, and the recovery time would be about 3 weeks versus 6 or 8 weeks. Well, that means a lot to someone who keeps a schedule like mine.
I think one of the things that patients ask me is the robot going to be doing my heart surgery? The answer to that, I can assure you, is no. Our hands are directing the robot in the movements that will carry out your heart surgery. The robot is at no point in time in charge of your heart surgery.
I had very little pain and discomfort. I know that they had me on pain medication, but I do not remember any serious discomfort from this surgery. The surgery was performed on a Wednesday. I went home following Saturday, just 3 days later, and I returned to work 3 weeks after the surgery was performed.
The benefits to you as a patient will be, number one, you'll have less pain. Number two, you'll be back to work quicker if you're employed. Number three, it's much more cosmetic. And number four, you're getting a repair done today that you wouldn't have got 2 years ago just because of the technological advancements that have occurred by us using this device. We're going to take good care of you. We're going to do the right thing for your heart disease. We are in a world-class university hospital with a really world-class heart program. It's not just an area of the hospital, it is a main component of the hospital. Our nursing care is dedicated to patients with heart disease, and our facilities are equipped and geared to a world-class heart program, which you're going to be involved in.